What's going on, guys? It's your boy Brad. I'm coming at you today with another video. Before I dive into this one, if you haven't already, be sure to hit that subscribe button down below. I'm putting out videos every week trying to help you guys obtain your dream of becoming a registered nurse. Enjoy the video. So the topic for this video, I've actually touched on rather briefly in a previous video, but I wanted to bring it up again and do a video just on it because I think it's pretty important. This is primarily geared towards my nursing students out there who are beginning clinical rotations, getting hands-on care with the patients, but this may also be applicable to current nurses out there as well. But what I primarily wanted to talk about is patients, how patients are people too. I feel like this is something that really gets overlooked a lot of the times. And like I said, this is primarily for nursing students. You know, whenever you begin clinic rotations and you're going into hospitals, and this is all might be brand new for you, you may have already had jobs in healthcare before, but a lot of times I feel like we get real wrapped up in the idea of, okay, I need to go in here, I need to introduce myself. It's like a template almost that we have in our minds of how we're supposed to do things. I got to go introduce myself. I need to collect vital signs. A lot of times we're real task oriented in the term of skills that we need to do. You know, I need to go in here and administer these medications and yada yada. And it's almost like we become robotic, so to speak. You know, like I said, we have a template, we have a script that we go through each day, each patient, and we mentally regurgitate. And a lot of times I feel like the human element gets lost. You know, whenever you do this job or whenever you are doing rotations for so long, I think, you know, we get in the mindset of it's work, and it's easy to forget the fact that these people are in the hospital or they're in long-term care, wherever you are. And, you know, it's a place they don't want to be. It's a scary environment for them. It may be, for a lot of your patients, the worst day of their life, you know, the worst hospital stay they've ever had, whatever it is that their current situation is. I think we often can overlook that, dealing with sick patients day in and day out, where we almost kind of become desensitized to it. They are not. The family members are most definitely not. They're definitely scared. They're terrified for their loved one's health, their condition, whatever. And so I just want to encourage my nursing students really not to forget the fact that patients are people too. It sounds kind of obvious, but if you start, just pay attention whenever you go to clinic from now on and self-analyze and see, you know, am I actually, you know, becoming kind of robotic? Am I going through the motions, so to speak? It's not applicable to everybody, but I know it is applicable to quite a bit. I've been guilty of doing it. We've probably all been guilty of doing it at some point or another. We get that mental script in our head, and because it makes our job easier, it makes communication easier. So really, if this video does nothing else, I hope it just, you know, reaffirms that idea in your mind of what nursing is at its core. It is a people business. That is what healthcare is. People helping people. Okay, so just a friendly reminder from your boy, you know, just to try and help you also, you know, become a more well-developed nurse, a more well-developed healthcare provider. Just don't forget that these people, these patients are people also. Anyways, it's your boy Nurse Bass, soon to be. I hope you enjoyed the video. Again, subscribe for all future content that I got coming out. Shout out to Mighty Nurse for all the shares that they've been doing, you know, really helping my channel grow. I appreciate everything that you guys do for me over there. And I appreciate all of you guys subscribing and watching my videos every week. Nurse Bass, soon to be. Peace.